What are the job prospects for people coming from the Southeast Asia in private practice, NHS? Are there more opportunities? Does things matter other than ORE and the personality, like a career-related qualification things for a general dentist?
So outside of London, you can get any NHS job you want, pretty much. There's a big shortage of NHS dentists out there. So once you've done your ORE, you've got your GDC registration, and you're going to do that supervised year to get your performer number, then you can pretty much get any job you want outside of London on the NHS. That will be pretty easy for you. Private jobs, a good private job is going to want some real history of cases that you've done, and it's going to come down to those things that we talked about, you know, the personality, whether you fit in with their team, and whether you're the right person for them as a practice and as a group. But if you're just looking to work as a general dentist and on the NHS is no big deal for you, outside of London you're going to find an easy time. Inside London is a different story, because everybody wants to live in London, or a lot of people want to live in London. So you might have a bit of a harder time finding a job initially. You'll probably start to want the same sort of level of case, kind of history cases that you've done, some sort of portfolio, even for an NHS job within London, because there is a good crossover of NHS patients who want private treatment within London. The further south you go, the more uptake you have for private treatments, and that becomes another thing to look at as well. If you're living further north, you're not going to get as much private treatment if you work in an NHS job, because just because it's an NHS practice doesn't mean you can't do some private treatment, because there's things which are available, things which aren't available. So there is a crossover there. The further south you go, the more wealthy people are generally, or in certain areas are more wealthy, then the harder it becomes to get jobs in those areas. So probably same as if you're trying to get a job in Dubai, or you're going to try to get a job in, you know, LA or somewhere like that. You know, it's harder to get a job there than it is in the middle of nowhere in those countries.
And are pay scales different too?
The base?
Pay scales, the salaries are different too.
Yeah, so NHS pay is actually higher the less desirable an area it is. So per patient, you see, if you do the same treatment in London and you do the same treatment somewhere in the middle of nowhere up north, you'll get paid a significant amount more up north, because they're trying to attract people into those jobs. Whereas you don't need to attract people into London, so the pay is a lot lower in London. So you then have to try and get private income to cover the shortfall there. At least that's definitely the experience some people that I know have had when they've done that. When they've been wanting to live in London, they have to do a lot more private work if they're trying to have that level of income. For some people, that level of income doesn't matter, and they just want to be in London. They're happy with whatever salary that is. So I think that's something to say for sure.
Cool. Yeah, that answers the question.